Thyroid cancer is a growth of your thyroid which contains abnormal cells. It is usually located in the inside portion of the thyroid. Anybody can get thyroid cancer. Usually we see that there's an increased risk on patients who have a family history of primary thyroid cancer, especially if it's a close relative for the patient. We also see that there's an increased risk for thyroid cancer on people who have been exposed to radiation, being because you live close to a nuclear power plant, or you work, for example, in the military in a submarine, or if you receive radiation treatment for a head and neck cancer in the past, particularly during childhood. Most patients with thyroid cancer will not experience any symptoms at all. The majority of the thyroid cancers are actually found when people have imaging studies, usually for some other complaint. For example, neck pain or neck tenderness. They might also be found because your primary care physician felt a lump in your neck while they were doing their annual physical examination. In fact, most patients with thyroid cancer have completely normal thyroid function. Once a nodule has been identified, usually your doctor will order a thyroid ultrasound so we can have a closer look at the nodule and to determine if the nodule looks benign or if it's concerning for malignancy. If the nodule is a large nodule or it looks a little bit concerning, your doctor will order a thyroid biopsy. This is just a very small needle that goes in your neck after injecting a little bit of numbing medication, and we will take some cells out of them. The cells will be looked at and we make the diagnosis out of that. Most thyroid cancer treatment consists of surgery. Depending on the type of cancer that you may have, the size of the tumor, and your risk factors, you may be a candidate to have a part of your thyroid removed. Some other cancers will require to have your entire thyroid removed for treatment. If the thyroid cancer has spread to the nearby lymph nodes, which is usually what happens in advanced disease, in addition to surgery, you may need another form of treatment, which is called radioactive iodine therapy. Most thyroid cancers do not need chemotherapy and do not need radiation therapy. I know the cancer diagnosis, or the C word, like a lot of patients say, is something that is very scary. I see patients every single day that come and they don't know what to expect. The reality is that thyroid cancer is something that grows very slowly, and we have advanced our treatment options, and patients do excellent after surgery.